Hi, all. I'm Jen Law, CEO of Community Access National Network, and this is your fourth quarter HIV-HCV Co-Infection Watch. The House finally has a speaker again, and that means appropriations bills will hopefully begin to flow. Importantly, advocates will need to watch these bills as they pass through the House and for any policy writers within them. When these bills were assessed in committee earlier this year, many HIV advocates called out appropriations for public health funding to be wildly inadequate, as the House version eliminated funding for the Ending the HIV Epidemic Initiative, cut funding from the CDC's PrEP programming in community health centers, significantly cut parts of the Run and White program, and eliminated SAMHSA's minority AIDS programs entirely. This all runs parallel to the fight to reauthorize PEPFAR, a program credited with saving at least 25 million lives across the globe in the more than 20 years since its inception. In a letter supporting PEPFAR, the Bush Institute is pushing hard to save the program, saying in part, abandoning it abruptly now would send a bleak message suggesting we are no longer able to set aside our political differences for the betterment of democracies and the world. Indeed, that's as true for PEPFAR as it is for our domestic HIV programming. Regardless of what passes the House, the Senate will also pass appropriations bills, and conference is expected. What to watch will be what lawmakers can identify as able to pass both chambers and garner the president's signature. Within these bills, the policy writers in question contain both poison pill writers targeted at extending the certain culture war issues, while others might look to address longstanding concerns in programs like 340B and the role of pharmacy benefit managers, or PBMs, in their responsibility in making medications harder for patients across the country to access. With serious concerns about how 340B is being abused by certain stakeholders, including those PBMs, contract pharmacies, and certain hospital systems, patients are often left asking, what about me? Stateside, several states are contending with a new drug pricing policy scheme known as PDABs, or Prescription Drug Affordability Boards. Couched as working to address out-of-pocket costs, some of these boards are empowered to enact upper payment limits, or UPLs, which limits what an insurance company is allowed to pay for a medication. That doesn't necessarily require the insurance company to make those medications cheaper for patients. So exactly who benefits from these UPLs? We'll keep an eye on these possible holiday Grinches, and in the meantime, take care of yourselves and your friends and your families. Until next time, be safe. Love y'all.